Dr. Chen's asking you, has your menses been regular?
Yes.
Always?
Yes.
Can you talk about
So I always had like 30 days, exact time it was used to be before.
30天周期，然后都是规律的。
But then after marriage, it got like 28, 29 days.
I see. So it's consistent, or does it like 28, 29?
Sometimes it's like 28 days. Most of the time, I think 28 days now.
他说结婚过后就变成28天了，有时候29天，可是结婚之前是30。
建议他月经3到7天做个造影。
Okay. So Dr. Chen says after you have a menses, right? And then after 3 to 7 days, this is the best time for you to go and do the HSG.
3 to 7 days after that.
Correct.
Okay.
Yeah.
So that's when my thing was done. Always the sonohistogram.
Yeah, but the sonohistogram is not showing us the shape. We want to see what's the shape of the uterus. Many times a miscarriage or fetal demise has very close relationship with the shape of the uterus. And then commonly this is very misdiagnosed.
Okay.
Yeah, some doctors will say it's healthy, but it's clearly there's a problem.
Right. So anybody can do it? Any radiology place can do it?
Anybody, just request HSG. 他说 HSG 要去哪里做呢？任何一个医院都可以做，对吧？
只要有那条件就可以。
Yeah, as long as they provide HSG, you can give them a call. It's pretty standard procedure.
Okay.
你把那片子发给他看看，让他做一个那样的片子。
I will send you a copy of HSG, then you can request. You can
right. Sure.
So you mentioned that there's also a left ovary cyst, correct?
Yes, dermoid.
Dermoid cyst. 院长他说他的左侧卵巢呢是稍微肿大的，然后有一个巨大囊肿。
多大
？The dimensions of the.
I think it's 4.2 centimeters. Sometimes 4.1, sometimes 3.9.
Let me check. Okay, so the dimensions here 这里是写4.1呢，院长。
4.1不大，生理。
Measures 4.76. Yeah, so it's not exactly a big cyst. So when was this diagnosed? Actually, like recently, before the pregnancy?
No, after the first miscarriage.
After the first miscarriage. Okay, so 院长它是不是个因素呢，院长？黄体功能不足？
不是。
Yeah, so Dr. Chen believes it's not a factor in the miscarriage. Probably not. Not really a factor because. Yeah. 所以那还有什么问题吗，院长？
So do I need to
做完造影再说。
Okay, so 他说他的子宫也是个倒置的，院长听说过吗？倒置子宫。
倒置的就是曲度太大。
对，跟那个跟直肠平行的，好像是。
那没事。造影吧，做造影吧，别说。
So Dr. Chen says
我们要的是宫腔里头的那宫腔的形态。So 他那说的外形没有用。
Correct. So Dr. Chen says here that all your reports and your blood work seems to be very normal, but what we need to identify is the uterine cavity shape, what it looks like inside. So the HSG can tell us that. Yeah, HSG is probably the best test that you can do now. Immediately we can diagnose what's the problem if you can do that. Yeah. So
did you go through all the blood work and stuff or no?
No, we don't have to go through blood work. Your blood work seems to be normal, so it's not the blood work.
During the
ferritin, you're talking about the ferritin.
Miscarriage, and then this February, it was like the iron shoots up so high, the ferritin shoots up so high, pretty much in the higher normal limit. Like usually it's 43, 70, somewhere there, but then it shoots up to 107, and then this February it was like 122 out of 125. The higher normal limit is 125. So there is nothing wrong with it, right?
Yes, no, it's not a factor. 院长他说他的铁蛋白发现到很高呢，是不是一个因素呢？他说
不是。
Yeah, it's not a factor. So Dr. Chen believes your blood work is normal, and then the ovarian cyst is also not a factor. So the final factor that we have now is the uterus cavity, the uterus shape, and it's very likely
HSG.
Correct, HSG. Very likely that is the cause. But then we will need to take a look at it lah. Then only we can see a proper image, see what we are dealing with.